Thank you for joining us tonight for this Medicare webinar series and the topic Medicare Part D, presented by the Pikes Peak Area Agency on Aging. We want to thank the Pikes Peak Library District for its partnership and support of this webinar series. Before we begin, we ask that you please make sure your microphones are muted until we reach the question and answer portions of the presentation. And now it is my pleasure to introduce our presenter, Roma Costanza, State Health Insurance Program Coordinator and Case Manager at the Pikes Peak Area Agency on Aging. Roma, it's all yours. And Roma, I think you're muted.
Sorry about that. Thanks, Jared. And good evening, everyone. Thanks for joining us again tonight for part 3 of our 4-part Medicare 101 series. Tonight, we are going to focus on Medicare Part D and talk about how that benefit works and what it costs in depth. Just a couple of housekeeping notes. I will pause during the presentation to see if anybody has any questions they would like to ask. If you have a question, you're welcome to type it into the chat box or raise your hand, and we will address the questions as they come in, or when I pause for questions, sorry. Hopefully everybody received the email that I sent out earlier this afternoon that included the handouts for this presentation, as well as the slides. If you did not receive that email, please feel free to let us know by typing your information into the chat, and we will be sure to get that sent to you tonight or tomorrow morning. And I think that's it, so we will go ahead and get started. So again, tonight we're going to be talking about Medicare Part D, the prescription drug benefit. We're going to start with just a quick overview of who we are. I am with the Pikes Peak Area Council of Governments through the Area Agency on Aging. And the mission of the Area Agency on Aging is to work with our partner counties and communities to create and develop and coordinate programs and systems that allow people to stay in the home and in the community for as long as possible. I am the coordinator for the local SHIP office, the State Health Insurance Assistance Program, which is a federally funded program that provides unbiased information and education on all things Medicare. This SHIP office, located in Colorado Springs, serves a total of 9 counties in Colorado. On this slide, I've listed both our local Colorado Springs number as well as our statewide toll-free number. Anybody who calls that statewide toll-free number within Colorado will be routed to the SHIP office closest to where they're calling from. And there is a SHIP office located for every county in Colorado, as well as for every county of every state in the country. Hopefully, if you attended last week, you participated in the survey that was included in the post presentation email that you were sent. The Centers for Medicare and Medicaid Services, as well as the Administration for Community Living, which runs this program at the federal level, is having an ongoing national survey that is done online. And we appreciate anybody who participates in those surveys because it does significantly help towards continuing the funding at a federal level for this program across the country. And again, this program provides unbiased information and education. So we are true consumer advocates, which I think is incredibly important when it comes to your Medicare choices. Quick review of what we've covered so far in weeks 1 and 2. Week 1, we covered Medicare Part A and Part B, including what it costs, how to get it, who's eligible for it, and what services are provided through those benefits. Last week, we talked about additional insurance options that you can choose from to go with your original Medicare A and B, including Medigap insurance and Medicare Advantage plans. And tonight, we're going to talk about the newest benefit of Medicare, Medicare Part D, the prescription drug coverage. So Medicare Part D, D for drugs. So again, this is the outpatient prescription drug benefit for Medicare. This is honestly the newest major benefit of Medicare. It's only been in effect since 2006. Prior to that, Medicare did not cover prescription pharmacy drugs. and people simply had to pay out of pocket if they didn't have other insurance coverage. The key to Medicare Part D benefits is that they are offered through various plans, which are offered through various insurance companies. And each plan that is available will have a different list of covered drugs, although they all must cover a range of drugs within the Medicare requirements. Typically, if you purchase a standalone drug plan or Part D plan, you will pay a monthly premium. All drug plans, no matter how you get them for Medicare, will have deductibles and copays, but there is financial assistance available for people who have limited or low incomes that could help with the costs of your prescription drug coverage. So we'll start with, should you enroll in a Part D? Well, as with all benefits of Medicare, Part D is optional. However, if you choose not to enroll in a Part D plan for some reason when you first become eligible for Medicare, there are only very limited opportunities in the future to be able to enroll in a drug plan. And if you didn't have a good reason for not enrolling in a drug plan, such as other drug coverage or creditable drug coverage through another source, then you could be penalized if you enroll in a Part D plan in the future. But again, if you have what Medicare considers other creditable drug coverage through another source, and that source could be a retirement benefit through past employment. It could be through the Veterans Administration, VA. It could be through active employment. If you have creditable drug coverage, meaning coverage that is as good as what Medicare Part D offers, or better, through another source, then you probably would not want to or need to enroll in a Part D with Medicare. And if at some point in the future that other creditable coverage that you may have now goes away, then you would be provided with a special enrollment opportunity to get into a Part D plan without penalty. If you decide not to enroll in a Part D plan and you don't have other creditable drug coverage, but you decide not to enroll anyway, simply because maybe you don't take any medications, keep in mind that you would be allowed to enroll in Medicare Part D down the road during any annual enrollment period, but you probably will end up paying more for that drug coverage when you enroll in the future in the form of penalties for not having enrolled sooner or having other coverage in place of it. So as with the rest or other parts of Medicare and Medicare insurance options, there are enrollment periods you need to be aware of. That includes your initial enrollment period or election period, which is the 7-month window that surrounds your initial eligibility into Medicare A and B. Typically, it's going to be that 7-month window that surrounds the month of your 65th birthday. Medicare Part D, just like Medicare Advantage plans, is also subject to the annual enrollment period, what we typically call open enrollment every fall. That's the October 15th through December 7th opportunity every year to either get into, get out of, or switch from one Advantage plan or Part D plan to another. Any change you make to your coverage during that time automatically goes into effect January 1st. And then, as I mentioned, there are special enrollment opportunities if you fall under specific scenarios, such as you had other creditable drug coverage, and that's why you didn't enroll in Part D, but suddenly that coverage goes away. Again, if you choose not to enroll in a Part D simply because you don't take any prescription medications, but you don't have other creditable drug coverage in place of that or instead of that, again, you'll be able to enroll in a Part D anytime in the future during an annual enrollment period, but you could be subject to penalties for not having enrolled in that drug plan sooner. The way penalties are calculated for Part D benefits is a little bit different than they're calculated for Part B as in boy benefits. For Part D penalties, what Medicare and Social Security are going to look at is adding 1% for every full month that you were not enrolled in a Part D plan once you became eligible and you did not have other creditable coverage. So if you wait, say you become eligible for Medicare in May, and you choose not to enroll in a Part D plan, but you don't have other creditable coverage in place of it, and you decide to enroll this coming fall during open enrollment so that coverage goes into effect in January, you could already be potentially looking at a 7-month penalty or a 7% penalty. How that's going to be calculated is they're going to base that 7% penalty on the national average benchmark premium. And I apologize, I thought I'd updated the slide. It's the national average benchmark premium. They're going to take that 7%, multiply it by the national average premium, and whatever that comes out to is going to be tacked on top of the monthly premium for whatever Part D plan you choose to enroll in. So if you choose to enroll in a $3 plan, it'll be tacked on top of that $3 monthly premium. If you choose to enroll in a $33 plan, it'll be tacked on top of that $33 monthly premium every month forever and ever and ever and ever. Because don't forget, Medicare penalties last forever. The worst part about the penalties for Part D, though, is that not only will they be tacked on every month for the rest of your life, or as long as you're enrolled in a Part D plan, but because that's based on the national average Part D premium, and that Part D national average premium changes every year, so will the amount of your penalty. It'll always be based on, in this example, 7%. But if that national average Part D premium goes up to $40 next year, your penalty would be 7% of $40 tacked on top of your premiums. So it can vary from year to year because the national benchmark premium will vary from year to year. Again, just like with Medicare Part D or Part B, good Lord, I thought I'd updated this. Just like with Medicare Part B, Part D premiums are also means tested, meaning they are determined, your premiums are determined by annual income. So just like Part B, if you had a higher annual income when you filed taxes in 2021, which would be the most complete income tax year that could be accessed by Social Security and the IRS to determine if you had a higher income. The higher income you have, potentially the higher Part D premium you could have. So this is not a penalty per se, but it is an increase in the premium or an amount tacked onto the premium of whatever plan you choose to enroll in when you do enroll in a Part D plan. As I mentioned in week 1 with the Part B means testing or IRMA, that can change from year to year based on what you file in taxes from year to year. But because this can only be based on the most completed IRS tax filing that Social Security can access, which was typically going to be a year and a half or 2 years old, then it's going to be based on old information. But if, for example, you had a high income because you were still working 2 years ago, but now that you are retiring and no longer employed, your income is going to be significantly reduced, then your higher premium, your IRMA premium that you have to pay the first year may go down the second year when they reevaluate your IRMA based on those taxes that they access the next year. So they will look at tax revenues every year, tax incomes and tax filings every year to evaluate whether or not you are still going to have to pay that higher premium based on that higher income. So keep that in mind. It's not a permanent increase if you had a higher income a couple years ago, but it will be potentially an increase, at least temporarily, when you first enroll in a Part D. Any questions about any of that so far? I do see a couple of questions in the chat. that I will go ahead and address. Let's see. I have someone who's been on Enbrel for 15 years for arthritis. It is a home injectable shot. I hear I will need to be more able to stick with this drug. How do I find out? So, and we'll talk about this in more detail as we go throughout this presentation. The key to Medicare drug coverage or prescription Part D plans is that each plan has a list or a formulary of drugs that they will cover. And each plan will have a slightly different list of covered drugs. That list of drugs could potentially change every year for any plan or even every plan. So what you're looking at needing to do is making sure every year during annual enrollment period that you check with your plan, whatever plan you enroll in that may cover that prescription today. You want to make sure you check with that plan every year to make sure that that plan is going to continue that prescription into the next year. The whole point of the annual enrollment period is not only because it allows you to make changes, but it allows the plans to make changes. So you need to be aware of any change that your current plan is going to make for the next year. And if for some reason they're no longer going to cover prescriptions that you take, you have the ability to find a plan that will, and the ability to search between the plans to find plans that will cover those drugs based on what plan will save you the most money on those drugs. And again, we're going to get into much more detail about that as we go. And then the next question is, how is coverage verified? I'm assuming other creditable coverage. So is it up to the client to provide documentation of coverage, or is there a way for Medicare or the government to verify that coverage? So typically it's going to be something that is self-attested. You're going to, when you enroll in Medicare, so say you delayed enrollment into Medicare because you were actively employed. When you go to enroll in Medicare, when that employment ends, you do have to fill out a form for Social Security that verifies with the employer, and the employer fills part of that form out as well, verifies with the employer that you were actively working and had employer coverage through that employment. If that coverage included a drug benefit, the employer is also responsible for advising you every year whether or not that coverage is considered as good or better than Medicare Part D. If you've been working in the past several years, you probably have gotten a letter about creditable drug coverage, about your employer health benefits, whether you're anywhere near Medicare age or not. So Medicare has federally mandated that employers who offer health care to their employees provide the employees every year with a letter of whether or not that coverage is considered creditable. So obviously you are probably going to either want to save those letters, or you'll depend on the employer to verify that when that form is filled out for Social Security. And that's basically how Social Security will verify that you've been covered. If that's not an option, or you're unable to get it verified that way, there's also a form that the Part D plans can send you individually and directly from the plans that they ask you to check a box off of a list of options of other creditable coverage. So you can self-attest that you had other creditable coverage without really typically having to prove it. So hopefully that answers that question. It's not typically something the government or Medicare is able to verify by themselves. And then as a follow-up to that first question, do I just ask for the formularies? That is certainly one way to do it, but towards the end of this presentation, I will be showing you the most effective way to look at the individual plans and their formularies every year during open enrollment. And it will be something that everybody can do on their own through the Medicare.gov website. So again, we'll get into that in more detail as we go. All right, so give me just a moment here. I want to try and find something. I am looking for my updated presentation. There we go. Sorry about that. There we go. Okay. So hopefully everybody's seeing the current updated presentation with the current 2023 information. My apologies. All right, so moving on. So how does Part D plans work? Medicare Part D plans were created by Medicare. So how they are outlined is standardized by Medicare. But then Medicare had to decide whether or not Medicare was going to administer this coverage themselves directly to you, which would have probably meant that everybody had the same coverage. And as we all know, one shoe does not fit all people. Or their other option was to allow private insurance companies to come and contract with them and give these companies enough leeway so that they would be able to offer different options to beneficiaries so that there was not a one size fits all kind of methodology. It allows you to have choices between your options so that you can shop around and find the best plan for the best cost available to you every year. The standardized outline of this coverage that all plans, all companies have to follow that Medicare has laid out states that every year, every plan could potentially have an annual deductible. For 2023, that Part D annual deductible could be as high as $505 at the pharmacy. What that means is if your drug coverage includes a deductible, when you go to use that plan for the first time in a calendar year, whatever medications you go to have refilled, you will have to pay full retail price for any and all medications you have refilled at the pharmacy until you have spent as much as the deductible, up to $505 out of your pocket. Once that deductible is met, then you would fall into the next coverage level called the initial coverage level or initial coverage zone. So once you've met your deductible, the next time you go to the pharmacy, you will have a much lower cost, hopefully, for those refills in the form of a copay. In the initial coverage zone, copays are supposed to represent as much as 25% of the retail cost of medications. So you would pay 25% as your copay, and then the plan would pay the other 75% of the retail cost of that medication. And you would continue to pay 25% copay for however many months it would take for you to reach a maximum out of your pocket spent of $1,165 this year. So you pay the first $505 in full retail price. You pay the next $1,165 in the form of copays out of your pocket. When the total drug costs, so if you added up all the cost of your drugs based on retail price, when the total retail price of all your medications within the calendar year adds up to $4,660, you will hit the next coverage level of your benefits. So you pay the first $505 out of your pocket in retail cost. The next $4,000 you only pay 25% of until the total retail cost of your drugs would have added up to $11,660. At that point, you reach what they call the coverage gap, also used to be known as the donut hole. In the past, when Part D was first created, if someone hit the donut hole level of their coverage in their Part D plan, what that meant is they had to go back to paying 100% full retail cost of their drugs. And they would continue to pay 100% full retail cost of their drugs until their total spending in that level of coverage hit a much higher mark. For 2023, that higher mark is a total of $11,206 and change. But that was in 2006. By 2012, the government started working towards closing the donut hole so that people no longer had to pay full retail price when they hit that level of coverage. And between 2012 and 2020, every year that amount that you had to pay in the donut hole was reduced from 100% down to 25%. So that as of 2020, if you hit the coverage gap or the donut hole, the most you'll ever pay for any medication at that level of coverage is 25% copay. And that applies to both brand name and generic drugs. So you pay 25% and the plan pays the other 75% until the total cost, the total estimated retail cost, hits the next level, which is an additional $5,800 and change. So you might be asking yourself, well, if I'm paying 25% copay in the initial coverage level, but I'm still paying 25% in the donut hole or coverage gap level, what's the difference? Why is that two different levels? And that is because a lot of Part D plans that are available for you to enroll in the initial coverage level do better than 25% copays. For example, a lot of Part D plans that you can enroll in may have zero copay generics or $1 or $2 copay generics. So they're not going to charge you a 25% copay. They're only going to charge you $1 or $2 or even $0 for those generic drugs that they cover that you take while you're in that initial coverage zone. But if you reach the coverage gap or the donut hole coverage zone, that zero copay would go up to 25% copay at the pharmacy. So that would be the difference between those two levels. Again, a lot of plans do better than 25% in the initial coverage zone. I've also noticed, especially in the last year or two, that even brand name drugs can be affected by those two levels. For example, if you take a $600 drug that retails for $600 a month, and in the initial coverage zone of your Part D plan, you only pay a $25 copay for that drug. When you reach the next level of coverage, that coverage gap, you're going to go from a $25 copay to a 25% copay. So your copay would increase significantly at that next level. On the other hand, I've also seen it go the other way. And I've seen people who pay a $40 copay in the initial coverage level. When they hit that next level, that copay goes down to 25% and their cost is reduced to $10 or $15. How that works with the individual drug companies and how the math adds up like that, I couldn't even begin to describe to you. I have no idea how they determine their prices, nor do I want to know. As long as they are following the rules for Medicare on how they have to administer these drug programs, Medicare is going to allow them to do those kinds of things. So that's the difference between those two levels. Now, if you hit that coverage gap level and your drug costs are high, you take really expensive medications, you could potentially reach the last level of coverage, which they call catastrophic. If your drug costs and estimated retail price were to reach a total within a calendar year of $11,000 and change, you hit catastrophic coverage and the cost of your drugs at the pharmacy go down to 5% or a $4.15 copay for generic and $10.35 copay for brand name, whichever is less. And that would be your coverage level until the end of the calendar year. And then come January 1st, the cycle would start all over. So all of this is based on a calendar year, and then every year it resets. Also keep in mind that the costs that we look at, the deductibles, the drug cost caps on each level increase every year. So when it comes to Part D plans, other rules that these insurance companies that contract with Medicare have to follow. Medicare requires all companies that sell Part D coverage to include at least 2 medications out of every class of medication available. So as long as every plan covers at least 2 cholesterol drugs, 2 high blood pressure drugs, etc., then they are within the Medicare guidance and following the rules. If they choose to offer more than 2 options, they can do that, but they can't offer any fewer than 2 for every class of medical medication available. There are some classes that every plan must cover any and every option on the market that falls within those 6 classes. And those classes include all antidepressants, antipsychotics, anticonvulsants, antiretrovirals, immunosuppressants, and antineoplastics, which are cancer drugs. Every drug on the market must be covered by every plan in those 6 classes. Any Part D plan can only offer prescription drugs on their formulary that have been approved by the FDA, and the FDA has approved them for their medically intended purpose, meaning the reason that drug was created. All plans must cover drugs, including biologicals and insulin. They must also cover the cost of the supplies for injecting insulin, such as gauzes, needles, and alcohol swabs, etc., syringes. And all plans must cover both brand name and generic drugs on their formularies. But again, these formularies can change every year. Once a formulary is set for a calendar year, they can only make changes to that formulary in very, very limited situations, such as, for example, say you take a brand name medication, it's been on the market long enough that the patent expires, and now it's going to become available as a generic. In that scenario, the plan that you have that's been covering the brand name could potentially change that brand name coverage to generic only coverage. Now, Medicare Part D plans, Medicare has also created rules so that you don't find yourself in a situation where suddenly you have a drug that you need to take that your plan does not cover anymore. Or if you are one of those people that have difficulty taking generic drugs for whatever reason, and your doctor recommends that you stay on the brand name drug, there are processes in place that allow you to request exceptions to those rules. And the plans would have to have a very, very good reason to deny any of those exception requests. So you should never be in a situation with your drug coverage where you are unable to get a medication that your doctor says you need to be taking. Even if you're prescribed a drug halfway through the year that is not on the formulary list of the plan that you've enrolled in, you can still request an exception of that plan so that they have to provide that drug to you at a copay so that it's covered, so that you don't have to pay out of pocket for it. So there's always going to be a process in place that allows you to be able to get what you need through your plan without having to pay out of pocket. As with all parts of Medicare, there are some things that are not going to be covered under this benefit. Things not covered are going to be drugs that may have already been covered under Medicare Part A while you were in the hospital, or under Medicare Part B in an in-office scenario. Anything that's considered over-the-counter, not requiring a prescription, will not be covered. Even if it requires a prescription, if it's a drug that is specifically designed to treat anorexia, or is specifically for fertility purposes or cosmetic purposes, Medicare Part D plans cannot cover it. Even if it requires a prescription, if it is a drug that's specifically and solely used to relieve cough and cold symptoms, and Robitussin is a perfect example of this, it is not going to be covered by your drug plan. And most supplements or vitamins and minerals that do not require a prescription are not going to be covered by your drug plan. Now, there are some exceptions to the vitamins and minerals category, but again, it would have to have a prescription and medical necessity from your doctor for it to be covered. Okay, so that is how Part D plans work in a nutshell. Any questions about any of that? Again, if you have a question, you can raise your hand or type it into the chat. I do see a question in the chat. Vaccines, what about vaccines? So vaccines such as the flu shot, the shingles vaccine, COVID is going to be added to that list, I think, starting for this year when the pandemic is declared done. All of those vaccines are actually covered under Medicare Part B as in boy. It's a Part B benefit. So even if you get those, because typically vaccines have to either be administered by your doctor in the office, or if you get it at a pharmacy, it has to be administered by a registered nurse employed at that pharmacy. It's typically going to be billed to Medicare Part B. Now, the exception to that rule, as I mentioned a couple of weeks ago, is the shingles vaccine. The shingles vaccine is covered by both Part B as in boy and D as in drug. So the administration of the shingles vaccine is billed to Medicare Part B. The drug itself would be covered under your Part D plan, your drug plan. Any other questions about how Part D plans work? All right, I'm not hearing any. I'm not seeing any other questions in the chat. And it looks like we will have enough time to do a quick live demo on the Medicare website. So as I mentioned before, there is financial assistance programs that could be available for beneficiaries who have limited or low incomes that are designed specifically to help with the Part D drug costs, drug plan costs. For people who are already on some sort of assistance program, such as SSI or Medicaid or a Medicare savings program that helps with your Medicare Part B costs. If you already qualify for and are enrolled in one of those programs, you will automatically receive help on your Part D costs. There are several different levels of assistance that you can apply for help with your Part D expenses. And that application is actually done through Social Security directly. Typically, the easiest way to do it is to go to the socialsecurity.gov website and do an application online. It takes literally less than 10 minutes. And basically, it's just an application that gives Social Security permission to look at whatever systems they can access at a federal level to verify income and assets. We also, at the local SHIP office, assist people with determining eligibility and with applications for this assistance on your Part D costs. As with all assistance programs, there are income and asset levels or limits. The most income someone can have in 2023 to qualify for assistance on Part D costs for a single person would be $1,843 in total pre-deduction income, with a maximum asset, liquidatable asset, of $16,660. Assets do not include the home that you live in, the property it sits on, primary vehicle, personal possessions. What they look for are going to be bank accounts, investment accounts, IRAs, annuities, money markets, those kinds of things. So the asset limit for 2023 is $16,660. Maximum income to qualify for any level of assistance And at that income, that would be the lowest amount of assistance you can qualify for, but is still worth applying for, $1,843 for a single person. Again, we do help with these applications, and we help people with determining eligibility for these programs at our office. So if anybody has more questions or wants more information about these programs, please feel free to give us a call, and we're happy to talk to you. If for some reason you are having difficulty covering the cost of your medications, even with a drug plan, and you don't qualify for that financial assistance, there may still be assistance available to you, depending on the drugs that you take. Most prescription manufacturers still offer patient assistance directly from the companies. Patient assistance income and asset limits are typically going to be much more generous than the limits through Medicare or Social Security. So you can have a much higher income or asset level and still qualify for assistance. The kicker to patient assistance programs, though, is typically they're only going to allow assistance to the cost of your drugs for brand name drugs. So typically the newer, more expensive a medication that you take, the more likely there is a patient assistance program available to help you pay for that drug directly from the manufacturer. I have listed on this slide several of the websites that we use to look for that information on any specific drug. And all of these websites can be very helpful in helping you locate assistance if you don't qualify for the extra help. So again, that's how Part D works in a nutshell. Again, Part D plans are offered through a number of different insurance companies that contract directly with Medicare. Each one of the plans that these companies offer, and I think in Colorado this year, there are a total of 20 different drug plans to choose from, which is not even very many. That's the fewest we've had ever to choose from. But each one of those plans will have a slightly different cost as far as premiums, as far as what drugs they cover, as far as their co-pays. You also need to pay attention to what pharmacies plans participate with or categorize as preferred or in network. Your co-pays at the pharmacy will vary from plan to plan. So it really can be a little more complicated to find the right Part D plan that's going to cover all the medications you need it to cover for the least amount of money. Fortunately, there's a good way to do that. You do have options on how to get that information. You could pick up the phone and call each Part D plan individually and ask them if they cover your individual medications, what the co-pays are, what the premiums are, and see if you can figure out which one will save you the most money. You can contact an insurance agent or a broker to help do that for you. But the most effective way to find the right Part D plan for yourself that covers all of your needs for the least amount of money is actually going to be to go to the Medicare website, medicare.gov, and use what we call the plan finder or the search engine within the Medicare website. The search engine was created specifically for this purpose. As I mentioned in week 1, you can create a personalized account on the medicare.gov website. I included this handout that kind of walks you through how to do that. And there are a lot of benefits to having an account, a personalized account. It is secure. It saves your information and your history. It allows you to look at claims in real time as they're being submitted by your medical providers. So there are a lot of benefits to having an account. It takes just a few minutes to set one up, but it's not required. And you don't need to have an account in order to use the plan finder for Part D purposes. So because we are running a little bit ahead of time, I will go ahead and do a live demo of the Medicare website. And while I'm setting that up, I'm going to look at a question. Why would a drug be covered under Part B? That's a good question. So there are some scenarios where Medicare Part B may cover a prescription drug. Typically, that is going to be a scenario where you are taking an infusion drug. So if you are getting chemo treatments at the cancer center, that is actually a Part B covered drug because it's a medication that can only be administered in a medical setting, but it's not an inpatient hospitalization. Osteoporosis medications must be administered. Some of them must be administered by injection by your doctor in the doctor's office. You can't take that injection at home by yourself. That would be a Part B covered drug. The only drugs covered under Part D are the drugs that you get a prescription from the doctor, you take to the pharmacy, and the pharmacy administers them. All other drugs would have to be covered under A or B or not covered by Medicare at all. All right, so give me just a sec. Oops. We are going to look at so now we're going to go to the Medicare website and kind of do a walkthrough of how to find this plan finder that I mentioned so that you can, on your own, if you choose to, do a search based on your specific drug needs to try and find the 1 out of 20 Part D plan that's going to give you the best coverage for the least amount of money. So what I've done here is I'm at the Medicare.gov website, Medicare.gov, and this is the home page. Welcome to Medicare. If I scroll down just a little bit, I'm going to see these 4 tabs. Hopefully everybody's seeing what I'm seeing. If you're not, please let me know. The second tab in, well, the first tab, you can either log in to your personalized account or you can create an account. Again, it just takes a few minutes, not required, but it can come in handy. The next tab that we're going to look at is the Find Health and Drug Plans tab. I'm going to click on it. The next page is going to give me 2 options. I can either continue on and log into my personalized account, or I can continue without logging in, which is the next option. And to continue without logging in, I simply need to enter a zip code and then select what type of plan I want to search for in this Plan Finder search engine. I'm going to indicate I just want to look at Part D plans, but you could also look at Advantage plans with drug coverage. You can look at Medigap policies, or you can learn more information. We're going to look at drug plans. So I'm going to hit apply and we're going to start. This Plan Finder, honestly, again, is the most effective way for anybody to find the most cost-effective, best coverage plan, whether it be an Advantage plan or a drug plan, from year to year. During annual open enrollment, that October 15th through December 7th opportunity every year, this is literally what all me and my counselors do every day, is help people one-on-one use this Plan Finder or run the Plan Finder for them on their behalf to make sure that they have the best coverage from one year to the next. So the next question, the next page is going to ask us if we qualify for any financial assistance through either Medicaid or SSI or Medicare Savings. I'm going to say I don't get any help. Hit next. Then it's going to ask me, do I want to see what my drugs would cost when I compare plans? I'm going to say yes. This is your opportunity to enter in all of your very specific medications. Quantities, dosages, brand name versus generic, tablet versus capsule. You can enter in all the specifics so that you know that your very specific medication list is going to be covered by whatever plans you look at. So I'm going to put in just a couple of drugs here. I'm going to put in, let's put in lisinopril. It also autofills drug names for you. I'm going to pick lisinopril. I'm going to add this drug to my list. It will default to the most commonly prescribed dosages and quantities, but you can alter that as needed by using these drop-down boxes, just hitting a little arrow on the side there, and change that if your quantity and dosage is different than what it defaults to. So I'm going to say 5 milligrams, 1 tab a day for 30 days every month. I'm going to add that to my list. I can add as many drugs as I need to, as specifically as I need to. Let me look at a brand name drug. I'm going to do let's do Lipitor. So Lipitor has been around a long time. It is available as a brand name drug still. So when I type in Lipitor and hit add drug, as most of us should know, that drug is now available as a generic because it has been around for a long time. And it's going to tell me what the generic alternative is. And it's going to ask me if I want to switch to the generic, which will be cheaper, or if I want to continue as the brand name, which would be more expensive and sometimes harder to get. So it's going to check your responses at every step to make sure that it understands exactly what you're trying to tell it. A lot of times people have been taking brand name drugs and then it goes generic and they don't know what the generic name is. So if you type in something like that, it is going to tell you the generic alternative. So I'm going to go ahead and let that add with the default of 40 milligrams, 1 tab a day for 30 days. You can also change the time frames from every month to 2 months to 3 months to 6 months to once a year. So that comes in handy if you take, say, what's that osteoporosis drug that you take once a week. So you could change that to 4 tabs every month or 12 tabs every 3 months. So you have the ability to kind of really customize based on how you take your medications. And then let's add one brand name drug. Let's go with, oh, why can't I think of a brand name drug right now? Let's go with an insulin. Let's go with Tremfya. That's a relatively new drug, which means it's pretty expensive. Only available in brand name. It is an insulin. So it's going to give me the option on how I inject the insulin, whether I get a pre-filled insulin pen or whether I get the vials and I fill the insulin syringes myself. I'm going to pick the pre-filled pen. I'm going to say I do 1 milliliter syringe 1 time a month. So that 1 syringe lasts me the whole month. And I'm going to add that to my list. Now, there is a new law that goes into effect this year that caps the cost of insulin for all Medicare Part D beneficiaries at $35. However, the key to that is that each plan will choose different insulins that they will cover that will fall under that cap. So it's not a matter of whatever plan you get, they have to cover any insulin you take at $35 cap. They're going to pick and choose what insulins they want to cover. So you would still have to look to make sure that whatever plan you look at covers your specific insulin. Now the plan finder, because that law was passed so late in the year, that information was not able to be uploaded to this plan finder for open enrollment last fall. So we're going to find out here in just a sec whether or not it's been updated in the plan finder now that we're past open enrollment and we're almost, a month and a half into the new year or not. If it's not been updated to reflect the $35 copay cap, then we're going to have to do a little bit of math, but that's okay. So I told it I'm done with picking my drugs. That's all the drugs I take. I click move to the next page, and now it's going to let me pick my pharmacy. I can choose up to 5 pharmacies. Pharmacies are going to be located within 5 miles from the center of the zip code that I entered initially, 80905. I can type in the specific name of a pharmacy if I want to look at it, just go to a specific pharmacy automatically. But it's going to give me a list of, looks like 59 pharmacies within 5 miles of the center of 80905, and I can pick up to 5 of them. Also, every Part D plan will offer a mail order option as a guarantee. So they all are required to offer mail order. So I'm going to check a mail order. I'm going to say I want to look at the prices at Walmart. I want to look at the prices at Walgreens. And let's see, and I've got several pages I can look at. I also want to look at King Soopers. So I'm going to pick these 4 pharmacy options. I'm going to hit done. Now the end result of putting all of that information in the system to this point is what we're going to look at next. The plan finder has taken all of the drugs that I entered. It's taken my pharmacy preference. And now we're at the end result where it's listing all, and it looks like 23 total plans available to choose from for Part D only. It's going to list all 23 plans, and it's going to list them in order of the plan that is going to save me the most money on my drugs at the top of the list to the plan that would cost me the most money on my drugs at the bottom of the list. So every plan that is on this list, and we're going to start with the first plan. This is going to be considered the most cost-effective plan available at $158,000. Let me take a look at that. So this is the most cost-effective plan. It has the lowest premium for 2023. It's called WellCare Value Script. Has a monthly premium of $3.50. It does have a $505 deductible down here at the bottom. But obviously I've put in some information incorrectly because it's showing that my drug costs with this plan would be $158,000. Let's look at the details. So again, it's going to reiterate the premium, the deductible. It's going to tell me of the 4 pharmacy preferences I chose. King Soopers is preferred in network. Walgreens is preferred in network. Walmart is only in network, not preferred, and mail order is preferred in network. And it's going to show me at each pharmacy what my copays for the year would be for each drug. And this is going to calculate the costs based on the assumption that you're going to enroll in this drug coverage to start the next month that you're doing the search. It cannot estimate anything other than calculating costs based on the first day of the next month for the rest of the year. So we can't change the time frame that it will look at, but we can certainly count backwards on the months that are left in the year. So for example, if you look at this today, but you're not eligible to enroll in Medicare until August, it will still give you information and calculations based on enrollment for March, but you can still look at it as if it were starting in August and what your costs would be for those few months. So clearly Tremfya is a very expensive drug. I scroll down a little bit more, but if I look at this with this particular plan, my 2 generic drugs, atorvastatin, generic Lipitor, and the lisinopril at King Soopers, Walgreens, or through the mail would have 0 copay. The Tremfya is the big problem. It also tells you when, at what point you're going to hit your different levels of coverage, when you're going to meet your deductible, when you're going to hit the coverage gap. And this is telling me that at each pharmacy, I'm not going to meet my deductible and I'm not going to enter the coverage gap. And again, this is the Tremfya talking. It's showing me month by month for the rest of this calendar year what my drugs would cost, all 3 of them together, every month at each pharmacy. And again, Tremfya is the problem here. If I scroll down a little bit more and click into an individual pharmacy, it's going to give me more detailed information. So this is going to tell me what the retail cost of the generic Lipitor and lisinopril would be, what my copay will be before deductible, what it will be after deductible. So those zero copay generic drugs are not applied to deductible, even though it has a $505 deductible with this plan. Then it shows Tremfya $15,000 before and after deductible. But if you notice, there's a little tiny notation here, a little 1 in brackets, that corresponds with a note at the bottom of this list that says this plan does not cover this drug. Price is shown at full cash price. So the problem is there are probably no Part D plans that cover Tremfya right now because it is an incredibly expensive drug. And that's okay. They're allowed to do that because they probably cover other insulins that means they're falling within the Medicare rules. Tremfya is not one of them. So now that we know that, I'm going to scroll all the way back to the top. I'm going to go back over here to this link that says back to search results. And I'm going to change my drugs back to drugs and pharmacies. You can go in and you can add drugs, you can remove drugs, you can change quantities, dosages, and edit your list of drugs at any time for any reason. You can play around with this without worrying about doing something wrong. You cannot screw it up because this is just a search. This is not going to enroll you in anything automatically. It's not going to disenroll you from anything automatically. You can go in and look at your different options based on different quantities and values and drugs, and just see what's going to work best for you and what's going to save you the most money. I'm going to take Tremfya out. I'm not going to add another drug. I'm just going to say I'm done. It still has my pharmacies populated, so I'm going to say I'm done. Now it's going to give me that list of all the plans from least costly to most costly. WellCare value script is still coming up at number 1, top of the list, $3.50 monthly premium, $505 deductible. But when I go to hit plan details, my drug cost for the year, if I scroll down, all the information is still the same. But now I'm seeing that I've got zero copay for my generics. My estimated total drug cost for the year, which is if I go back to the list, you're going to notice that it's going to say the plan name, the premium, and then it's going to say total drug and premium cost for the rest of 2023 for both retail pharmacy and mail order. And it's going to add together the copays for all your drugs with each plan for the rest of the year, every month, and the Part D premium for this plan for the rest of the year, every month. It's going to take those two factors, add them together, and total them up right here. My total cost for the rest of the year, if I start this plan in March, 10 months left in the year at $3.50. My total cost for the year is $35 with this plan because my copays for the generics are zero. If I scroll down to the next plan, that total estimated cost for the year goes up to $98. This plan has a $5.80 monthly premium times the rest of the year copays with this plan, SilverScript Smart Saver. Again, it's going to show us for this plan that King Soopers is preferred, but Walgreens is not even in network. You would not want to use Walgreens, they don't participate. But Walmart and mail order are preferred. It's going to show you estimated cost and copays for the rest of the year at each pharmacy for those two drugs. And again, you'll notice because Walgreens is not in network, they're showing full retail cost at the high end. Going to break it down as to whether or not I meet my deductible or enter the different coverage levels of the benefit. And then it's going to break down month by month for the rest of the year what my copays for those two drugs will be at each pharmacy. Looks like this plan in particular has $2 copays for those two generic drugs that are not applied to deductibles. So I don't even go into deductible because I have two generic drugs that aren't applied to deductible. I'm going to pay $4 a month in copays. I'm going to pay $5.80 a month in premiums. I add those two together And that's how it comes up with the $98 estimate for the rest of the year. As you go down this list, this estimate for the rest of the year will increase and increase and increase. So this truly is going to do all the work. It's going to do all the math for you, and it's going to show you what your estimated total cost for the whole year is going to be with any plan. It is the best tool you could ever think about using for this purpose. It would be incredibly time consuming and probably very frustrating to try and calculate all of this on your own by calling each individual company. Let the plan finder do it for you. It's what it's designed to do. And it does it very, very well. Again, we do help people with using the plan finder, or we help them by doing it for them and then just helping you interpret the results at the end. But the bottom line is, when it comes to medical costs, cost is the biggest factor for most people. And because this sorts it by costs, meaning this is clearly the most cost-effective plan I could enroll in for this year, why would I not want to do that? Now, there are other things that you can look at, such as star ratings. You know, if that's what you want to look at, I don't put incredibly a lot of stock in that. I don't think they're comprehensive enough to be that useful. But you can look at those as a factor. WellCare has 3 out of 5 stars. SilverScript has 3.5 out of 5. No plan has 5 in Colorado. There are no 5-star plans this year. Some plans have very low star ratings, 1.5. Some of these plans are very new. They've only been on the market in Colorado for a year or two. That could explain some of their low ratings, but most plans are going to average at about 3 stars. And again, as we go down this list, premiums get higher, total costs out of pocket for the year get higher. And it's going to show us the total of 23 plans. These 23 plans are the plans that are available throughout the state. So these are your plans to choose from. So I'm going to stop sharing. Go back to the presentation. So again, we're happy to help people through this process. We're happy to walk you through the process if you want to try it on your own. However you want to do it, we're there to help support you in that endeavor. And again, I strongly encourage you to try it out. Play around with it. You can't screw it up. You can't accidentally do something, but you can certainly look at the different ways your costs are affected by different things. So to wrap it up, other resources that you could potentially look at for this information, the Medicare and You Handbook. Again, you can either order the handbook by calling 1-800-MEDICARE and asking them to mail you a hard copy specific for Colorado, so that you can see all the plans listed at the back of that book available in Colorado. You can go to the Medicare website and look at the Medicare and You Handbook for this year, not state specific, but you can look at it in PDF form. You can call 1-800-MEDICARE and a representative will actually do this with you as well. Again, they're available 24 hours a day, 7 days a week, 365 days a year. You can go to the Colorado Department of Regulatory Agencies, or DORA, which houses the Division of Insurance, which houses the SHIP program within the state. And they post every year a comprehensive list of all the plans and the premiums and some various costs of all the plans. And I've included some links here. In your electronic version of these slides, you should be able to just click on these links and go straight to the information. But again, the plan finder is the only option, the only tool that you're going to be able to use that will do the work for you and provide you with that end result information. All right, so that is basically all I've got on Part D for you. Are there any other questions before we wrap it up? Okay, so I do see a question. Do you have a plan that does benefits like Silver Key? I'm going to need a little bit more information about that.
Like, do you have, like, you guys just did a wonderful job with just telling us which plans had everything that we wanted. Is there some place where we can go in and say, these are the benefits we would like to have, and it will give us those plans that have those benefits? Like silver sneakers.
So like silver sneakers?
Yeah.
So typically those kinds of benefits are going to be included in Advantage plans that we talked about last week. They're going to be all those extras that Medicare doesn't cover itself. Part D plans only cover drugs, period, no extras. But if you're looking at Advantage plans that include a Part D, certainly you can use the plan finder, or we'll help you walk through the plan finder, or we'll walk it through for you. And instead of looking at Part D plans, it'll actually show us all the Advantage plans. And with the Advantage plan search, it gives us the drug costs for the drugs that you need covered by a plan, but it will also show all the co-pays for medical services like office visits and x-rays and ambulance rides and stuff. And it will tell you what other additional extra benefits that plan offers individually, such as the gym membership or dental or vision. So the plan finder can be used for those searches as well. And if you come and visit us, or you want to give us a call on the phone, we could certainly help you with that, and then give you that end result of a comparison of all those plans. Are there any other questions? You're welcome. So it's all clear as mud. Again, we are happy to talk to you about this information. We're happy to talk to you about going through this plan finder. We'll walk you through it. We'll help you through it. We'll do it for you. Give us a call. We're happy to talk to you one-on-one at any time. Wrap it up. Last couple of slides. As I mentioned before, we are also the SMP program for our area, which educates and empowers people on Medicare fraud and abuse. My contact information. You can always email me at seniorinsure@ppacg.org. Give us a call. I've got 5 full-time counselors, including myself, and 2 part-time volunteers. Appointment times. This is our slow time of the year. We can schedule appointments within a day. So that's not an issue. Further it gets in the year, closer it gets to the end of the year, appointment times may take a couple of days to get, but appointments, we have plenty of counselors, so appointments are quick and easy to schedule. And that's all I've got for you tonight. I appreciate your patience. I appreciate you coming and joining us for this presentation tonight. Next week will be our last of the 4-part series, and we will talk about other insurance options besides what we've talked about so far. So we'll look at how employer plans, retirement benefits, military benefits, marketplace benefits, how all of those interact with Medicare, and what you may or may not need to do about them if you're becoming eligible for Medicare. So hopefully I'll see you all next week for that information. Otherwise, last call for questions or comments. And then I'll turn it over to Jared to wrap it up for us. All right, take it away, Jared. Thanks, everyone, and have a good night.
All right. Thank you very much, Roma, and thank you all for taking time this evening for joining us for this Medicare webinar series. We hope this information has been helpful for you. Our next webinar, as Roma mentioned, will take place next Thursday, February 27th. Already, yes, at 5:30 p.m. and it'll cover Medicare, Medicaid, and other insurance options and what you need to know. Actually, that should be February 23rd, now I realize. If you haven't already registered, you can register at ppacg.org/events. And you will receive a survey after this webinar is complete, and we would greatly appreciate your feedback on your thoughts and how this webinar can be improved. This webinar will also be available on demand on our website tomorrow afternoon. where you can also find the first two webinar topics there, Medicare eligibility and coverage for Parts A and B, and Medicare options with Medigap and Medicare Advantage plans. Thank you again for attending and have a great night.
Thanks, everyone. We'll see you next week.